Hey, good afternoon. And I want to welcome all of you to tonight's Military Police Regiment Association mentorship session. I'm very excited about tonight's session. We have some dynamic speakers tonight. We have retired Sergeant Major Jeff Chirigiano that's going to present tonight. And Jeff is going to present from the Veteran Affairs Administration level. So he's going to give her an overview. He's a special assistant to the VA. And I thought it would be good to kind of bring him on tonight to present topics at the VA level, at the department level. So he's going to do a great presentation. But also, I want to remind you that pretty much he's going to really only going to talk about current state of the VA. So, we probably have questions that come up during the presentation on the future of the VA. We're going to hold those. We're only going to talk about current issues. The second presenter tonight is a dynamic speaker, a great mentor of mine. And I'm glad to have Colonel retired Mac Huey on. I've been knowing Mac probably over 25 years. And Mac came to me about 2 months ago and said, Gerald, I want to participate in this great program. So Mac's going to give a presentation tonight. He is basically going to be at the Veteran Support Officer level. He is a representative in the Mississippi area. And we heard his presentation, so I'm excited to hear that tonight. Go ahead to the next slide if you don't mind, Beth. I want to say our thanks to Beth and Aaron. We really can't do this without them. This is our third NPR session, and I would tell you a lot of work goes into these sessions. I think the first session we had talked about the status of the military police regiments, and Colonel General Albright did a great presentation that kind of laid out the way ahead in the first briefing. The second briefing we had, we looked at federal hiring procedures. And I think, too, that we had some dynamic participation, and we're still getting emails to this day on people that really want to be helped as far as finding a job in the federal sector. And this one tonight is basically going to be talking about Veteran Affairs benefits. And so these are some of the topics in the future that we're going to talk about during these presentations. But we have them every quarter, and we have, pretty much, we have the next one. Probably going to be talking about civilian hiring process. Next slide, please. A couple things to note. Your attendees would not be able to turn on the cameras. If you got a question, put it in the chat box. And Aaron, she would give me the questions at some periodic point throughout the presentation. We'll go ahead and ask the panel members to answer those questions. So make sure you put them in the chat. And again, only talk about current VA benefits, because like I said, we don't know. I know it's an election that occurred last week. So we pretty much can only tell you pretty much what we know. And if you have any personal questions, case-related stuff, that's something that happened in the VA process, we'll get those back to you. We'll send those over to Mac Huey, and we'll make sure we get those questions answered. So tonight as we go through, we're going to answer as many questions as we get. But I understand, like a couple of presentations we had to go back in and send those answers back out to those panelists, participants. So we'll make sure we get those back to you. This webinar will be recorded, and for you to go back and kind of take a look at it as well. All right, next slide, please. Overall, you're looking here, this is going to be the agenda for tonight. Really, the NPR mentorship program overview, we kind of gave you an overview of that. Looking at VA benefits from the department level. Jeff's going to do that. Mac's going to do the federal, state, and county level. And we'll follow up with some NPRA membership information. We do have a couple of people tonight that are not members that are on the call. And we'll pretty much tell you how to get signed up to be a member at the end of the webinar. And then we have a closing. Next slide, please. I go ahead and turn it over to Jeff. Jeff, go ahead and take over.
Hey, well, good evening, everyone. It's so glad to be here back with the MPs. I'm actually going through the attendee list, and it almost looks like there's like a mini reunion going on. So I'm glad to see a lot of familiar names on here. Again, like Gerald said, Jeff Chirigiano. I work at the Department of Veterans Affairs, Special Assistant to the Undersecretary for Benefits, and really I'm the DoD and military liaison between the interactions that go on between the senior leadership in the VA and with the DoD. And so today I'll provide you just an update of some things that are going on in the VA, and hopefully that will help you in your journey. If you got any questions, please let me know. I'd be glad to answer them as we go. So can we get to the next slide, please? Here's the agenda. I'll start with a general overview. I'm going to talk about the PACT Act, kind of where we're at with the PACT Act. Hopefully most of you guys know what the PACT Act is, but I'll give you an explanation of it. And then we'll cover three specific benefits: disability, healthcare, life insurance. And then for those that still have that influence in the military community, an ask on the other end from you guys when it comes to transition. And then we'll turn it over. Mac will pick it up from there. So next slide. I always kind of like to start any kind of discussion with what the VA is and the organization of the VA as we're looking at it, because navigating the VA can be somewhat challenging and it's sometimes frustrating for our veterans as they come in. Because next to DoD, it's the second largest department in the federal government. And I know since everyone here is affiliated with the military, I always like to kind of use the analogy that if you think of it as if you're a civilian and you're trying to figure out and want answers about aircraft carriers, going to Fort Benning is not the best place to go when you're trying to find out about aircraft carriers. There's much better Navy and all these other kind of places that you want to go rather than Fort Benning. And a lot of times our veterans do the exact same thing. They'll go to the Veterans Health Administration when they're trying to get something that's in the Veterans Benefits Administration. So a quick, simple breakdown as we look it through. If you think of Department of Defense, you have Department of the Army, Department of the Navy, Department of the Air Force. Very similar. We have three administrations across the board. The Veterans Health Administration, as you think about that, it's probably the face-to-face. It's the largest integrated healthcare system in America. Over 1,200 facilities spread throughout America. And the VHA provides all things healthcare. That's what VHA does. If you go to the far right, you have the National Cemeteries Administration, and that's final resting place. That's all the cemeteries, 155 cemeteries throughout the United States. That individuals, that's where you would do your final resting place, burials, and those kinds of performances. Any other benefits besides healthcare or laying to rest, everything else falls within the Veterans Benefits Administration. Primary contact, you can walk into most Veteran Health Administration, any outpatient clinics throughout America, face-to-face, that's what you often see. The Veterans Benefits Administration, most of these things, disability compensation, education, home loans, insurance, a lot of these things, we have regional offices, pretty much one in each state, but it's generally contact is through the phones. So we have phone numbers where you can call and you can talk and you can ask your questions or you submit your stuff online. Next slide. So we talk about the PACT Act. This was signed into law on August 10th of 2022. It is the largest expansion of benefits and care to veterans since the 9/11 bill. And it's primarily focused on our post 9/11 and our Gulf War veterans. And it's really focused around burn pits and toxic exposures. And if the veteran is ever diagnosed with one of these 23 conditions that you see here on the list, anytime in life, later in life, it will be automatically presumed that this condition they developed was related to their service and connected to their service. And what's a little bit cooler about this is if you really look at some of these presumptive conditions, especially if you look at the left side all the way at the bottom, respiratory cancer, it's of any type. And so that can include your lip cancer, that can include all the way down through your esophagus cancer, all the way down to the lining of your chest wall. Any of the cancers that you develop in your respiratory system, over 30 of them will be counted. So when we see 23 on this list, it's not just 23. It's over 300 different conditions that an individual will be able to receive. You'll see who is eligible for it. It's for those that deployed, and those are in the areas that are listed before for the Gulf War from 1990, and then for post 9/11 as we start looking at 2001. It also adds some things in there for our Vietnam era veterans. So we talk about Agent Orange exposure, like hypertension. Most of our Vietnam veterans are over 65 years old. And you think about how many veterans who are over 65 years old who have hypertension, many of them do. Well, it's automatically presumed that their hypertension was related to their service in Vietnam. And that means that they can get compensation for it. It can expand them to be eligible for other benefits, and it means that they can get health care with the VA. And the last thing I'll talk about is I think is extremely important of these is because you have a lot of veterans that might come up and say, well, I'm 100% like, or I've already maxed out, or I don't already have these things. I don't need to qualify for any of these other conditions. But the most important part is for survivors, I think, because if you were to ever die of any of these conditions that you see here on this list, then that means that your survivors or your spouse could receive dependency and indemnity compensation of dying of a service-connected disability. So it's extremely important as we look at it. Glad to answer any questions you guys have. There's a lot of research going into it. It'll lead me into the next slide as we go through another aspect of the PACT Act is like when they ask, well, what about those veterans that didn't deploy and weren't in these areas, but they were exposed to toxic exposures? Well, the PACT Act covers that. If you look at it, you'll see they call it the toxic exposure risk activity. If you believe that you were exposed to toxic exposure because of your service and it was outside of those combat areas, like let's say asbestos or lead poisoning or these different kind of things, you're able to now file a claim. And what that does is it triggers two things. One, it will trigger VHA to automatically start helping you with your healthcare eligibility to get treatment for whatever that issue is that you're claiming to have. And then two, it'll trigger a forensic examination to be conducted by the Veterans Benefits Administration and get a medical opinion on whether they believe that that toxic exposure was related to your service and how to get you there. So it kind of covers all aspects of veterans. And the third step that the PACT Act does is it really gives the VA, it took years and years and years for us to try to get some of these conditions that are on there. Congress gave us the ability to go ahead and now look at other conditions. And we have other conditions on the rise that we're continuously looking at every single day about how do we analyze and how do we look at these new things that we see as veterans are going through burn pit registries and all these other kind of research projects to be able to say, what's the next step that we need to be looking at to see if we need to take care of these veterans because of their exposure. Next slide. So what does that all mean, I think, in the grand scheme of things to the veteran? Well, I would say expect longer waiting times. You're going to see the chart that I have displayed over you. It really goes back to 2010. You'll see that back in 2010, at the peak of 2013, we had over 600,000 claims that were in our backlog status, meaning that they're taking more than 125 days to process. We did so much work in the VA of modernization that we brought that down to a steady state for about 4.5 years, where we kept the claims under 100,000 and we kept pushing that through. But then we came into COVID and all the non-emergency procedures across the nation were canceled. No one was going to appointments. You'll see kind of that COVID-19 era where we start seeing the spike in the backlog rising. You'll see that we start getting through where we open back up to the exams and then we drive it back down, and then the PACT Act hits. And you'll see where the PACT Act hits in January 2024. We hit that peak of 423,000 claims that are in the backlog. You'll see in the bottom of the chart, what does that mean? It takes the average veteran today 144 days, around 5 months on average from the date that you submit your claim in order to get a response or a determination of that claim. Now, veterans can expedite that a little bit quicker by making sure they go to their appointment that's first offered and do those kind of steps. But that's just letting us know that realistically, just expect the longer wait times. What does that also mean? The VA operates on a first in, first out basis. So don't say because there's a huge backlog, I'll just wait a year or two to go ahead and submit my claim. Your claim's not going to get submitted until the day you start. So make sure that you submit your claim now when you go through there. And we're hitting this thing. You can see the numbers are going down. We're getting through modernization. We're doing machine learning. We're doing a lot of ways to scan thousands of pages in seconds and being able to extrapolate the data that we need to do. A lot of innovation has gone into this procedures. A lot of funding has come from the PACT to get us to that state. We're hiring a lot of people. And a lot of the things that we're focusing on, and one of the efforts in the VA that we're looking at is how can we hire transitioning service members and bring them into careers within the VA. And you'll see down on the bottom, we have the WARTAC program. That's the Career Skills Program or the Skill Bridge program that we offer. Last year, we bumped it up, and in FY23, we had over 689 service members who left that came directly and worked right into the VA. and it's a GS 7, 9, 10, or they can come in a 9, 10, 11, 12 track, which is an accelerated promotion in 3 years. They can be a GS 12, which is a really good program that we have for individuals. Next slide. So how do you file claims? There's two ways to do it. You can do it pre-service or prior to separation through the benefits of delivery of discharge program. I think that if you're still in, you need to do this. You need to communicate to your service members that you know to make sure you apply under the benefits delivery at discharge program. It is the most crucial step that I think anyone can do in this process. And I say this because when the VA determines claims, there's 3 conditions that have to exist. The first condition is you have to have a current diagnosis or current illness that you have to have. The second thing you have to have is you have to have some kind of injury or illness that occurred in service that can relate to that. And then you have to have a medical nexus, which is a connection to tie those first 2 things together. And if you can tie those 3 steps and you can tie them together, then you are able to determine that it's a service-connected illness or injury. And many veterans get out and they wait years and years and years to file their first claim. And when they wait that time, it's hard for the VA to determine, did that injury occur while you were on active duty, or did that injury occur in the years between the time that you got out? Well, with a BDD program or filing a claim while you're on active duty, it automatically sits there and says that you are claiming that there is an issue that occurred while you were on active duty, and you're documenting in those medical records to be able to come back and later use that as evidence throughout your career or your life as a veteran. And so the VA might come back and be able to say, well, there's not enough evidence to begin with, and you might get denied, but later in life, like, that could change. Or the VA might come back and say, well, we see that you have this condition and it's 0%, but in later life, it's going to get worse, and we can go ahead and we can raise those rates. But if you file a claim while you're on active duty, it brings up that percentage so much higher to be service connected. And so I can't foot stomp enough in reference to applying for your benefits in BDD. 90 to 180 days is the timeline. Make sure you talk to individuals about it. In reality, around 55% or more individuals are applying for a disability claim within the first year of separation. Those numbers just go up. So if you're thinking that somebody is not going to file a claim, there's more than a 50% chance that they are. So make sure that they do it before they get out, not wait until then. I'll let Mac talk about with the county VSOs and what they do with the other 2 types of claims. I'll just kind of give a little shout out for the power of intent to file, which is down in the bottom of the claim. You don't have to submit your full claim, or veterans don't have to submit their full claim with the VA. They can just go to the VA and they can say, I intend to file a claim. And that would give the veteran and their veteran service organization, it would give all of them up to a year to go ahead and submit the claim from the time they intend to file. But what the VA will do is that when that claim gets granted and it gets approved and they get that percentage, it's not going to go just back to the date that they submitted the claim. It's going to go back to the date that they hit the intent to file. So they can actually have over a year plus of back pay that comes to them with that intent to file. So it's a very powerful tool. Again, I'll let Matt go into details a little bit about that at the county level. Next slide. Okay, so another thing that we have on the rise is we have a lot of predatory bad actors. And think about, like, when we had all those payday loan activities and everything that we had off the military installation, and always trying to target our service members and try to target our veterans. It's no different in the VA, and there's no different in people trying to scam or try to go after and hit our veterans or transitioning service members. It is against the law for somebody to file to charge an individual to file their initial VA claim. You can get a lawyer, and you could do like supplemental claims, and later on down the line you want to do your appeals, and you might want to do other claims in the future. But your initial claim, you can't charge an individuals to do that. It's against the law. And one of the things that there is a lot of predatory actors that are going out there and trying to use the vulnerability of our folks that don't know any better to charge them to do that. We have veteran service organizations that are out there. You can think of just some examples of the VFW. You can think of Wounded Warrior Project. You can think of DAV, Paralyzed Veterans for America. We have a lot of services out there that provide this service for free. They'll go through and they'll evaluate the individual's records and they'll help them out. We have counties and state entities that are out there that help them file their claims for free. It's a free service. And there's a lot of people, like, if you want to know, like, exactly, like, well, who is authorized to do that? Who has been trained and who has been accredited and certified and hit the credentials from the VA to do this? This is the website to do it. You just go to the va.gov website or OGC website. You can just type in the name of the individual that you were given or that you're talking to. You can pull them up, just put in some basic stuff, and it'll say, hey, this person's accredited. They're good to go. Go to talk to them. But make sure as you're talking to your folks and your peers and for yourself, like, that this is extremely important. Don't be taken advantage of. There's challenges when people start getting into contracts and all this other stuff, because it just goes down this whole rabbit hole. Bottom line, don't pay. There's veteran service organizations that do great jobs that can do this for you. Next slide. And when we talk about disability, I know I spent a lot of it. So many people think about it's monetary compensation. It's not just all about monetary compensation. It is a lot more that's going to help individuals and give them the full arsenal of benefits that they're entitled to based off of their individual service. And I have the money. You can look at the money on the left and you can see what that looks like. But it really gets down to the ability for those individuals to get into healthcare, their prioritization in healthcare. You have a 10% disability rating, you're able to use VA healthcare. You might have to pay some copays in small amounts, but you get that healthcare with a 10% or above. You're in for VA. You can use it for all services, not just those that you're service connected for. And then some of the other benefits that you can see that you're able to get onto military installations. You get that 10-point veteran preference. You can get direct hiring authority, a lot of stuff with VR&E, and all these different kind of things that just kind of add on with it. And that's not just this is just the federal level, but there's many other things that you offer at the state level and local levels and the nonprofit organizations that offer with a disability. You want to make sure everyone has everything that they're fully entitled to based off in commitment with their own individual service. And disability compensation does that by giving them let the VA say yes or no, and then let them know what they're able to achieve. Next slide. A lot of people ask, why VA healthcare? I always say, why not? Like, we have 18.25 million veterans, and about 50% of our veterans use VA healthcare. I use a personal story that I'll share real quick is my brother. He was a veteran. He served in the Navy. He got out of the Navy, and I was talking to him, and I was like, hey, do you have VA healthcare? And he's like, no, I don't need VA healthcare. I got my employer healthcare insurance. And I was like, yeah, you need to sign up for VA healthcare. Like, you can just have it, right? You don't have to use it as your primary, just use it as secondary. 3 weeks later, after having that conversation with my brother goes to the ER. He gets a bill for $18,000. He gets an $18,000 after insurance, his medical insurance covered it. He got a bill for $18,000. Had he had VA healthcare, he would have paid nothing. It would have been free. Like, he wouldn't have had to pay any of that cost. So why not have VA healthcare? It's an earned benefit. You earned it, sign up, have for it. I think it's a great service. I use it as my primary. Like, that's my choice. I have TRICARE. I'm retired and I can use my VA. I love my VA. I can just call and get on the app and say, hey, I need my prescriptions. They mail it to my house. I don't even have to go in. When it's time for me to get, like, I need to go to referrals and stuff like that, I just text my provider, and I don't even have to come in to see them. They just say, here you go. Just physical therapy. Here's a list. Go straight to physical therapy without having to go to them. So there's a lot of great advantages of using the VA. I love it. But my last pitch to it, 92% of veterans, our scores continue to rise in this area. 92% of veterans trust their VA healthcare. Next slide. Life insurance, a couple things with life insurance. Everyone generally has SGLI as they're serving, and that will expire at 120 days. You have VGLI, which is the term life insurance that replaces SGLI. That is very time sensitive. You only have a certain times that you can do that, up to 240 days after you get out. to sign up for that benefit without having to have any kind of proof of good health, and a year and 120 days if you were to provide some kind of good health, if that's what you choose to do. I really encourage people to think about life insurance like 18 months prior to separation or prior to getting out. Get a good civilian whole life insurance. Check those rates, see what's comparable. Get yourself locked into a term insurance. And if not, know that VA life insurance and VGLI is there for you. I mean, the whole reason why it was created is for those individuals who got injured and couldn't find civilian life insurance. It's decent to me. Like I can use VGLI or I can use my federal employee health insurance, life insurance. And VGLI is actually cheaper than if I were to go the route to use my federal employee. So you got to really weigh those and see what's better for you. But we do have the newest thing available to you, and that's the third one over. That's VA Life. We kicked that off on January 1st of 2023. And this is a whole life insurance policy. So it's not term, it's whole. What we'll do is we offer up to $40,000 of guaranteed coverage. All you have to have is a service connected 0 to 100% of any type. And you can sign up at any time. You don't have, there's no time limits that are associated with this. Whereas before you had time limits associated. But what you have to do is you live 2 years, and that 2 years after you've been contributing to this for 2 years, then you hit that term, and then you're able to receive this if anything were to happen to you. But it's really for that final resting settlement and to go ahead and have your family safe at the end of your life. And then we'll go into the last thing I'll talk about. And the last thing that we have, next slide. And this is the ask. Really, as we have, especially as you're looking to the community, you're talking to individuals, importance of transition. We've gone through 3 major evolutions of transition. I think back, if you think in the early 90s, a lot of us went through, we had ACAP, Army Career and Alumni Program is what we had. It was a volunteer program for that. The VOW Act came out in 2011, where it started saying, okay, well, it's not voluntary anymore, it's mandatory, but it set the timelines within 180 to 90 days separation. The third overhaul that we had in this was NDA 2019, really started taking effect in 2020 as we were developing this. And it had 3 major changes to the way that we did from the VOW Act. And it had 2 significant clauses that I think are very important warning signs of what we do with military leaders and the ability that we give military leaders to have leeways to make decisions, but sometimes not knowing the impact of the decisions they make. And the first change that we had is it extended it and said that by law, all service members will start transition no later than 365 days from their separation date. The second thing it did is it required an initial counseling, a one-on-one counseling with a counselor to determine like what's their plans, what their goal is to create an ITP, an individual training plan, an individual transition plan for that individual to prepare for them. And it assigned them into a tier. It either said that right now this individual is either fully prepared for transition, moderately prepared, or that they're not fully prepared at all. And if they're not fully prepared at all, the law required to saying you need to do all of the transition. The third thing that it did is the VOW Act, and some of us, when we transition, we think about it in the old system, you went to TAP 5 days, like you're in, you're out. It's a cookie cutter thing, one size fits all. The NDAA made the changes to this to be able to say, hey, we're not going to make a cookie cutter. We'll have 3 mandatory training days, a DOL, a DOD, and a VA day. But then we're going to break that DOL workshop down into specific tracks. And so we can spend 2 days now focused on if your goal is to go to school when you get out on education, or your goal is to employment or small business, like you can make these different kind of choices in the tracks that you want to take. The clause that I say on this is, and the important thing to do this, is that it also gave the commanders the ability to waive the training. So now individuals, instead of having to go through 5 days of training for TAP, the commanders can make the choice on the ground and say, hey, you're only going through 2 days of training or 3 days of training. And that becomes very dangerous when it comes into that transition space, especially when commanders and first sergeants don't know what it's like on the other side because they've never really got out, but they're making the decision to say, no, you don't need to go, get back in the formations, we're going to go do this. And it becomes a very cautionary tale that we have to be very careful on a slippery slope The whole reason, like for me to come over in the VA in the first place, I was the Sergeant Major of the Army said, hey, we need somebody to go to the VA because we have individuals that are committing suicide, veterans committing suicide. And in that transition space, suicides are twice as likely than the rest of the veteran population in that first year of transition. And it's 3 times higher in that first year of transition for suicides than on active duty. And so it is really turbulent time. And to kind of give this ability to do this, that waiver is very challenging. And then the final thing that is on there to talk about the significant clause is that one thing it does have is it says everyone who goes through TAP, they'll have an exit brief or they'll go through a capstone exercise. And that company commanders or the unit commander or unit leadership needs to sign off. Well, in that final capstone exercise, they're initially the TAP manager or the counselor is going through and they're asking the service member, hey, do you have a place to live when you get out? Do you have a job when you get out? And they're asking key events on that. What they do is they get that form, they pile it up, they put a signature on it, and they send it to the email address of the company commander. Well, the company commander's got a lot of emails in their inbox. If a company commander is just opening it up and saying, I got to sign this to get Joe out, they just sign it, they turn it around, and they send it back. If they're not reading that, they might not know exactly what's going on with that service member. They might not be able to assist the service member in that interaction. And so it's that gatekeeper at the very end to be able to stop them, to be able to identify those challenges with it. And we see a lot of people just signing it and then just moving on. And so, just being able to have that touch point about the importance of leadership and involved in the process about could you really give 2 additional days just to get these people through? And could you make sure you're reading through that warm handover would be beneficial. And here we'll go to the slide next. Before I wrap it out. And this is what the recent GAO report did when they found the study for it. They found out that only 25% of individuals started TAP on time that transitioned by law. It's not a regulatory requirement. It's not in the 600-something-20 requirement. This is the law that says that people have to start it. This is how many people were starting it by the time the law was written. Most individuals are not starting this process. This stat is specifically looking at individuals who suffer normal separations. It excluded everyone who was getting chaptered out, all these different kind of issues. It just looked at a person who went through ordinary transition, only 25% hitting the timelines. And when we look at the fact about to the extent of the services waiving the 2-day, this is the company commanders waiving these 2-day courses. The Army is doing fairly well compared to the other services where you see 92% of them being waived of having to go through all 5 days of the courses, but still 40%, company commanders are saying 40% of individuals do not need to attend. And the final stat on there is when we talked about those that were at full risk for transition, 22% of them just didn't attend it at all. And so if any ask is for us to make sure that we stress the importance, most of us have been out, we know what it's like on the other end, just to have that communication back on the other side with leadership to be able to say, hey, let's get these guys to the transition. So last slide I got on here is we'll just talk. Hey, at the end of the day, a lot of great things that are going on in the VA, a lot of efforts that are going on there every day. It's busy. It's 100 miles an hour as we're trying to get things going on. We have a lot of great initiatives. I'm not going to go in depth with them because we're just limited on time today. But what I want to say is that there's been a lot of effort and a lot of work that's in this space. If you know of individuals and veterans who have not touched out or reached out to the VA, let us know. And I'll leave it in closing is that we do not do this all on our own. The VA is small compared to the amount of veterans that are out there. And if it wasn't for our partnerships with our nonprofit organizations, if it wasn't for our partnerships with our Veteran Services Organization, and especially Mac's getting ready to get on right now with our county Veteran Service Organizations, we wouldn't be able to do what we do. So I appreciate what everyone does out there in the communities and helping veterans get the benefits they've earned. And Mac, I'll hand it over to you to what you do over there at the counties. Thank you.
Okay, thank you. Thank you, Jeff. Just to add me a note, if you do have questions, just put those in the chat and we promise to get back with you. I appreciate Gerald allowing me to participate with our MP family tonight. And what Jeff said is a very important thing that you should know about as future veterans and for those of you that are veterans now. So what I want to do, as Jeff said, is just give you a snapshot really at the county level. So if you think of VA as a command structure, you have Jeff at the department level. And as he mentioned, you have a regional office usually in each state. And then the majority of counties in the states across the United States have guys like me, county veteran service officers, that can help with all your VA benefits. And I've got kind of an overview snapshot, but what you see on this one slide is pretty much it in a nutshell. I mean, VA benefits are just tremendous. And I can tell you, I've been in this job now for about 7 years, and I can tell you, information flow is not that great. So, you know, there are people everywhere across the United States that could be getting benefits and really are not. So what I want to offer to you for time's sake tonight is for our MP family, I would love to go one-on-one with you. My contact information will be in this slide deck, my phone number and my email, and we can go in and do a deep dive if you want to on your particular question or issue, but we just won't have time for it here tonight. So what I really wanted to hit, first of all, is do a drill down from what Jeff talked about on healthcare. Tremendous benefit. It's really a 5-tiered system. First of all, you have the VA medical centers. And to get signed up for VA healthcare, in my opinion, the absolute best way to do that, to establish your eligibility, is by applying in person at a VA medical center in the eligibility office nearest to you. You can also apply online, you can apply by phone, you can apply by mail, but to me, that face-to-face communication, there is no replacement for that, and you will actually walk out of the door of the VA medical center signed up with a VA health card, which in essence is your VA insurance card. It's also covered on the Affordable Care Act. So that is your required insurance should you take an opportunity to apply. To get started, or when you go sign up, you're definitely going to need your DD-214. When you become a veteran, there is no document that's more important than that DD-214. I can't tell you how many people walk into my office and I say, let me see your DD-214. They're like, what? I'm like, yeah, that's your golden ticket to everything to do with a VA. So for sure, if you're already out and you don't have a DD-214, you want to negotiate with VA or work within the VA, you're going to need that. And then when you do get out, make sure you have a copy in your important document area, and probably you should file one publicly at your local courthouse, usually in the Chancery Clerk office, and have it as a matter of public record for the future. So you need your DD-214, you need your current insurance card if you have one. Some might be on Medicare, you would need that Medicare card. Jeff mentioned TRICARE. Usually it would be a good idea to take your last tax return and your out-of-pocket medical expenses, and if you have one, your VA disability letter. So it's really easy to get enrolled in VA healthcare if you're a combat veteran. I won't say it's automatic, you still have to go through the drill, but if you deployed and you're a combat veteran, you're pretty much in. It's just a formality of getting signed up. If you have not deployed, then most of the time it's going to be income based. Of course, you have to serve at least 2 years of active duty, or if you're reservist or National Guard for the period you were called up for. If you got in before 1980, it's only 90 days. And you, like Jeff said, I'll use myself as an example. I use VA healthcare as a backup, as a secondary. I use my TRICARE as my primary, and then I use VA healthcare for certain things like these beautiful glasses you see here. Okay, those are from the VA. You need hearing aids, which most insurance won't pay for. They have excellent mental health care, as well as a variety of other things at the local level. So at the VA Medical Center, that is where you would get started. The second tier is community-based outpatient clinics. Short name is your local VA clinic. If you wanted to be, you could be assigned to a subordinate level, if you will, down to the CBOC level that will be probably more near to you than the VA Medical Center. And then you would be assigned a primary doctor at that CBOC or a nurse practitioner. And most of these CBOCs are under contract with the VA. So to stay in the system, once you get signed up, all you have to do is go to your annual wellness checkup. And that's probably good anyway, because they'll do labs on you and your doctor will talk to you about it. And that keeps you in the system. As Jeff said, there are 8 priority groups for VA healthcare. The closer you are to one, the more benefits and the less copays you will have to pay. To be in category 1, you have to be 50% disabled or higher. And if that's the case, you have no copays and VA healthcare is completely free for the rest of your life. The third tier is community care. It used to be the old choice program, and now it's called community care. And basically, like any other insurance, your VA healthcare provider can give you a community care referral for specialty care. For instance, dermatology, cardiology, urology, services that are not provided in the clinic itself, they can outsource it and give you a community care referral, which prevents you from driving maybe an hour or two to the VA Medical Center. So that is an excellent benefit, and it works in the benefit of the veteran to get that referral. The fourth tier is urgent care. This is something relatively new since I think about 2019, but it is awesome. So like right here in my community, I have 2 urgent care facilities that are under contract with the VA. And if I've got a minor illness or injury, I walk in, show them a VA health card, and it's free. You can get 3 visits a year at no cost. So that is an excellent benefit for urgent care, because the community care, the outpatient clinic, and the VA Medical Center are all appointment-based, but urgent care, like I said, is minor injuries and illnesses. And then the last tier, the 5th tier, is emergency care. Of course, if you're having a valid emergency, you go where you got to go to get taken care of, but you would need to have yourself or a family member call the VA Medical Center that you're assigned to, usually within 72 hours, to record that in the computer and make sure that that's going to be covered and paid for by the VA. So really, VA healthcare to me can be primary, as Jeff uses it as his primary. I use it as my secondary. A lot of our veterans can't afford supplemental insurance. So they're using, they have maybe Medicare Part A and Part B, and then they have, of course, their VA healthcare. So it is an excellent healthcare, in my opinion. Like any other healthcare system, you're going to have issues occasionally, but for the most part, I highly recommend it that you get signed up. Okay, next bullet there, and like I said, I'm only hitting some major bullets here. The next one I want to talk about is disability benefits, particularly compensation. Jeff hit on it. It's a tax-free monetary benefit paid to veterans with disabilities that are the result of a disease or injury incurred or aggravated during active military service. I tell you, I was in the Army 30 years, and my whole experience with the VA was visiting wounded soldiers in VA facilities. That's about it. I had no idea about the mechanics of the VA. It can be very bureaucratic. Much like the Army and the MP Corps, there's a lot of documentation, there's a lot of paperwork that needs to be done. But the most important advice I could give you is documentation. You're going to need medical evidence showing, as Jeff said, that service connection or tie or nexus into the military. You have to have a current diagnosis. And before you ETS, for sure, don't let the sun set before you ETS without you getting a complete copy of your medical file. When I got out, I went over to Fort Leonard Wood to the hospital, and they gave me my medical record on a CD. And somebody that's been in for a long time, you're talking hundreds of pages. But you really need that. Trying to get it after the fact is problematic. It can be done, but if you can get a copy of your complete medical record before you get out. And of course, I've already talked about the DD-214s. And it's not just your last one. There's a lot of you out there that have gotten multiple DD-214s based on your enlistments, and you need those. You need all of those. Many conditions are presumptive in nature. Jeff talked about the PACT Act. He didn't mention, I don't think, Agent Orange for Vietnam veterans, but there are a lot of presumptive conditions. In other words, you pretty much get automatic service connection if you've got one of those conditions and you served in one of those areas covered under the law. And I didn't mention it, but the VA is much like the military. Everything is codified in United States Code 38. It's all laid out there in detail, everything from healthcare through all the way down to claims. So that is, I guess you'd say, the VA Bible is USC 38. A couple of examples for presumptive service connection would be under the PACT Act. For those of you that were in the Middle East, would be like sinusitis and rhinitis. Both of those conditions are listed under the PACT Act based on burn pit exposure. For a Vietnam guy, diabetes is one of those. Heart disease, diabetes, prostate cancer, all presumptively linked to exposure to Agent Orange. So my advice on compensation, when you put in a claim, please don't try to do it yourself. I've had a lot of veterans come in, and the younger guys especially, try to do it themselves, and that's certainly something you can do. But you should, I recommend, go to a person that does it for a living, because we know all the latest rules, regulations, guidelines in putting in claims. So go see a VSO. You can get American Legion representative, a veteran of foreign wars, a Purple Heart Association, Vietnam Association. There's all sorts of advocates out there that will help you free of charge file your claim. Let's see what else I want to hit there. If you're married and have children and you get a VA compensation rating, like Jeff mentioned, if you're 30% or higher, just like when you're in the military, you're allowed to add your spouse and your children. Your children can stay on your claim until they either turn 18. If they go to college, you can keep them on there until they graduate from college. And at the end of the day, the benefit of adding your dependents is more money. You get paid for yourself as well as your dependents. So last thing on compensation, you can be service connected, rated between 0 to 100%. I won't have time really to go in more detail on that. But like I said, if you want to go one-on-one, that's fine. The next bullet, disability benefits, is pension. Just real briefly, it's an additional benefit outside of compensation that is a tax-free monetary benefit payable to low-income, that's the key, low-income wartime era veterans. Don't have to have been in combat, but you have to have served during a wartime period. It's income-based. Out-of-pocket medical expenses are considered to bring down your gross income, and it's basically supplemental income. Nobody's going to get rich off a pension, but it certainly does help for those veterans that are in nursing homes, in assisted living, have sitters that they pay for out of pocket. Those are the primary three reasons why a veteran might want to file for a pension if they can't file for compensation. Okay, next, education and training. I won't spend any time on that. If you have any specific questions, I'll be glad to take a phone call later. I will talk about DEA just a minute, Survivor and Dependent Education Assistance. If a veteran is ranked 100% service connected, then basically their children or their spouse can go to school, college, and VA will pay a monthly stipend to that dependent to go to school. Similar to the GI Bill, but for DEA, the dependent gets a direct check to help them go to school. So excellent benefit, separate and apart from the GI Bill transfer of funds, transfer of GI Bill months to your dependents. Home loan guarantee, buy a home, build a home, refinance a home. You can apply for a certificate of eligibility, take that to your lender and get the VA interest rate. Memorial benefits, you see them all listed there. The first four are memorial type burial benefits, and also you can get partial reimbursement for burial expenses for the funeral and the plot if the veteran was service connected. And any veteran can be buried if they desire in a national or a state cemetery. Here in the state of Mississippi, we have 2 veteran cemeteries at state level, and we have several national cemeteries. And that's, I guess you could say, free, free based on the veteran service once the remains enter the cemetery grounds. Okay, real quick on survivors benefits. Surviving spouses have similar benefits. They can apply for survivor's pension if their husband was a wartime era veteran. And the rules are relatively the same as pension for a veteran. They might be able to get dependent DIC. That's supposed to be dependency and indemnity compensation. If their veteran spouse was 100%, then they might be eligible for the DIC, which is very generous, roughly $1,600 payment a month to that surviving spouse. CHAMP VA is for those spouses whose husbands were 100%, and it's excellent insurance, medical insurance for the spouse. Life insurance, Jeff mentioned that. I'll only hit one example. You see down here, Veterans Affairs Life Insurance, VA Life. As an example, the premium cost for a 55-year-old veteran, if they wanted $10,000 coverage, would be $40.10 a month. If they wanted and you can get up to $40,000 in $10,000 increments, but for $40,000 for a 55-year-old, it would be $160 a month. Not bad, probably very competitive with the commercial market, and a lot of people want to sign up for it really as a death benefit to help toward final expenses. And the last thing, I'm out of time here, is state benefits. I can't speak for other states, but here in the state of Mississippi, if a veteran is 70% or higher, they can get 2 disabled American veteran tags for $1 a piece for 2 vehicles in their name. If they're 100%, they can be exempt from ad valorem property tax, which is a huge benefit, and then hunting and fishing for a lifetime. Of course, we have 4 VA state nursing homes here in our state, and if you're 70% or higher, that is absolutely free, no charge. If you are not service connected or up to 60%, it's $65 a day, roughly $2,000 a month. And there is no way you can touch that in any private nursing facility. So excellent benefits. And the last slide I've got, if you'll flip over that, is to me, you need to educate yourself. Educate, educate. Learn all you can about VA, what it's about. You're not going to be able to see it, I don't think, here, but you can Google. I don't have it on the slide, but you can Google VA Federal Benefits Handbook 2023 version and get this electronically. But everything I talked about, pretty much everything Jeff talked about, is laid out in this Federal Benefits Handbook. And these resources listed on this slide are excellent and will teach you everything you need to know about the VA. And that's all I got. And I appreciate the attention. And like I said, I'll be glad to go with you guys one-on-one. Just give me a call.
Hey, Matt, great job. We just had one question from Rob Arnold. He mentioned, hey, just for everybody information, we will have these slides sent out on the email. If you attended the night session, we'll send those slides to you. And also they'll be on the blog next week as well. We'll make sure we get those out to you. Question that Rob had was, Mac, you brought up a point about in-person visits at the VA medical facility. Can you reiterate?
What I was saying, to get started, to get signed up with VA healthcare, it's advisable to go to your nearest VA medical center, go to the eligibility office and get signed up. I also mentioned you can do it online, you can do it by phone, you can do it by mail, but to me, you get the personal touch by going face to face, and you're going to have your VA health card anyway. And so you can get that knocked out while you're at the eligibility office. They'll mail it to you within a couple of weeks and you'll be set. I mean, you will know immediately whether you're eligible and enrolled in person right there at that time, rather than waiting for the mail or, waiting to do something online. To me, the face-to-face communication can't be replaced.
All right. Hey, great job, Jeff. Great job, Mac. I think this is a great information across the board. I learned some over the last couple of days is talking to Mac and Jeff. But tonight's presentation was a home run hit for me, so I'm pretty sure it was for you. At this time, I go ahead and turn it over to Beth. Go ahead and cover the mentorship piece, membership piece as well. If you can cover that, Beth.
Absolutely. Thank you. Well, I want to thank everybody for joining this evening. One, it's very important for us to follow up on our memberships and the various benefits of membership. So here on this slide, you'll see what some of those are. And then one thing that if you are already a member, thank you. Just make sure you have your updated contact information with us. There are still some members out there who are utilizing the old email address, us.army.mil. And so we're unfortunately not able to reach out to those folks because those are no longer valid. So we have updated to request to personal email addresses, so that way those continue to follow you along. You'll see with the various memberships, and we also have the 10% discount when you shop with us in our gift shop. But the importance of membership, one, it's about the sense of belonging. It's already being bigger picture type things, and then the networking opportunities that are involved with it. And although these webinars are a newer concept to MPRA, we want to continue to utilize these platforms in order to promote the association, and again, the benefits that come along with that. If there are specific questions about membership, please feel free to reach out, as we're always just a phone call or an email away. Are there any questions in regards to membership?
All right, next slide.
Here essentially is just what the cost is. So for those who are not already existing members, these are the options. And you can go directly to our website and it specifies specifically those options that are available. One thing that is not included on the website is, for example, the standard lifetime membership, where you could do that in 3 monthly installments. So there's some people who may not be able to, or for budgeting purposes, not able to do the full 300 at one point in time. We have broken that down over a period of time. Like I said, 3 monthly installments of $100. You choose whether it be like the 1st or the 15th, in order to process those payments. And then we're also, as new opportunities become available, we are sharing them with our membership, whether it be through Constant Contact or social media platforms. But we're constantly trying to get the word out there about what MPRA is continuously doing, not just here at the home of the regiment.
All right. Next slide. Hey, one other thing too is that I think we have a contact slide in there as well. And we is it still in the briefing, the contact information on the panelists?
Following once the completion of the webinar. Yes,
Oh,
sir.
okay. Yeah, we'll make sure too. We got a contact slide in there as well about all the participants that attended tonight's ceremony event. And also we have the information on Jeff and Mac that we'll send that out to you as well. So Mac has offered to pretty much, you know, if you need any questions related to anything dealing with health issues or the VA at the VSO level, Mac is willing to answer those questions for you. So we have that information now. You know, but the main thing I want to say tonight is this is really a great event. And it really makes me proud, you know, as a former military police colonel, to actually do these sessions. Because these two guys reached out to me and say, Gerald, how can I help? And tonight, that's what it's all about. You know, guys like Mac and Jeff covering this VA stuff. And that's definitely information that we need for our veterans. So tonight, you know, it's pretty much we're just a group of people just willing to help. So if you really want to get involved, you know, we got a passion for giving back. The MPRA with Mr. Williams, Rick Harney, Aaron and Beth, and I got guys on my team like Oliver Saunders and Mike True. We really got a heart for giving back. So that's pretty much who we are. We want to help. You know, we want to serve. Anything that we can do to help the veterans, the MP community, active duty reservists, that's what we're here for. So that's kind of why we started this mentorship group. But tonight I want to say thanks for again for Mac and Jeff for participating. Great information. And if you got any other topics that you may want us to cover, give us a call and we'll definitely make sure we get those on the calendar during a quarterly event. So next slide, please.
That is the last one.
Okay. So we got that. We got a contact slide here. We'll send out to you on the email. It's not in this actual presentation here, but that contact slide will be in the presentation that we sent out. And Mac's information will be in there with his cell phone number, email address, along with Jeff. But overall, Aaron, Beth, as always, great job. Behind the scenes, these two ladies, they put all this stuff together and kind of make this presentation go very, very smoothly. And I also want to thank the leadership of the MPRA as far as they want to give back, you know, because the thing is about membership is important. But I think too, is the MPRA as an organization, I've learned since I've been on the board of directors, as far as in giving back, is very exceptional to some of the programs they have. So tonight, I hope you enjoyed this session. And again, Jeff and Mac, home run presentation. So pretty much that's all I have. Do you have anybody else? Any closing comments from Aaron or Beth? Anything I missed?
This is Aaron. I don't have anything.
Okay, Beth,
No,
you got
sir.
anything?
No, sir.
Hey, Oliver, you got anything?
No, it was great presentations. Thanks.
All right, again, thanks again.